Welcome to the 9th module of our educational program.
Last session, I discussed the importance of forming healthy eating habits with your child. It's important to form these healthy eating habits early because it develops a foundation for lifelong healthy eating and reduces conflict relating to eating. I went over foods to encourage from 6 months on, which included some fruits, vegetables, whole grains, meats, and dairy. I also went over foods to avoid in the first year, including honey, fruit juice, cow's milk, and products with peanuts. I also went over nutritional and lifestyle factors to consider with those with autism, including the importance of improving digestion, balancing blood sugar, increasing those omega-3 fats, increasing vitamins and minerals, excluding food additives, identifying food allergies, addressing nutrient deficiencies, and ensuring an optimal intake of essential fats.
And in my segment about coping with maternal mental health, we talked about unhealthy coping such as denial, blame, or disconnection. We talked about healthy coping strategies such as support, meaning making, and nurturing oneself or self-care. And then we also talked about preparing for maybe a big life event by developing healthy coping skills ahead of time, by finding your interests and your passions, writing down when you'll practice that skill, and then also practicing that skill daily. So I had a couple different things I wanted to fit into my segment of this module. So for this segment, we'll be talking about activity-based coping strategies, branching off of the coping strategies we learned on the last module. We'll learn about some natural remedies, and then also stigma. So let's talk about some activity-based coping strategies. So let's talk about aerobic and non-aerobic activity. So exercise in general has been studied for many years relating to the relief of mental illness symptoms. I'm sure we've all have heard about participating in physical activity and how it has great effects on mood and health. So aerobic and non-aerobic activity do have different meanings. So we can think of aerobic activity as maybe walking, jogging, or running. And then non-aerobic activity can be coordination training, flexibility training, and strength training. So first we have walking, and in a study, walking for 30 minutes per day outside provided overall relief of depressive symptoms. And outdoor walking for 30 minutes per day was clinically significant in reducing overall depressive symptoms. Strength training was also shown to provide relief of overall depressive symptoms. And then in a study, running, they found that it can provide the same benefits and alleviation of symptoms as psychotherapy. The study had 3 total groups, one using running only, one using running and therapy, and one using only therapy, and all had the same amount of alleviation in symptoms, and they all experienced the same overall benefits. Another activity-based coping skill could be gardening. So that can improve overall mental well-being. It can increase your physical activity by digging or bending over, picking things up. Reducing social isolation, so gardening can be beneficial either by yourself, but you can also do it in a group to find more benefit. And then it also increases the amount of time you spend outdoors. So the next activity-based coping skill we have is yoga. So yoga is proven to be beneficial in alleviation of symptoms in those with mental illness. In a study, those with maternal depressive symptoms and PTSD were shown to benefit from participating in yoga. Not only is it beneficial in reducing depressive symptoms, it also is effective in reducing anxiety symptoms due to the component of mindfulness and promoting relaxation. Yoga can also improve your focus, relaxation, sleep, and energy. And yoga can improve cognitive functions possibly by the emphasis put on concentration and control of body movements, which can lead to alterations in the brain structures. And it can also provide immune functions and also enhance your cognitive abilities. Next, we have mindfulness. So mindfulness is the act of being fully present, aware, and not overly reactive. When we are stressed, anxious, or depressed, we can tend to just roll through the motions of the day without putting much thought into it. So participating in mindfulness trains your mind to stay in the present and slow down and pay attention to your breathing. This can make you feel more centered and grounded. Mindfulness is shown to provide benefits to people with mental illness, but especially to women in the postpartum period. Mindfulness has also been shown to alleviate depressive symptoms. If you are just getting started with mindfulness, maybe just an easy Google search or a YouTube search will give you great ideas on how to begin with this coping skill. There are also many videos that provide guided mindfulness trainings. So for the next segment of this module, I would like to discuss some natural remedies. So these may or may not be helpful to those experiencing maternal mental illness or really any other kind of mental illness at any point in time. So it's important to keep in mind that what might work for some people might not work for all. I used evidence-based research for all of these suggestions, but as always, it's important to discuss with your doctor or professional for medical advice and treatment. As a reminder, these are not intended to fully treat mental illness, such as depression and anxiety, but they can act as a short-term symptom reliever. So first we have lavender tea. Studies show that 1 cup of lavender tea before bed can have positive short-term effects such as less fatigue, less depressive symptoms, and increased bonding with the infant. There are also studies about the relaxing scent of lavender oil being beneficial in alleviation of stress symptoms. If using essential oils, make sure it's good quality. There are many stress-relieving products on the shelves as well that have lavender scent. They have different maybe bubble baths or lotions and different things like that. But as always, make sure you're consulting your doctor if you have any health symptoms that might prevent you from using a lavender scented product. Next we have turmeric. So this is actually an anti-inflammatory, and studies show it can reduce inflammatory markers that are usually upregulated in depression. In a study, 25 milligrams of turmeric per day was shown to have significant increases in mood after 4 and 8 weeks. This is something that could possibly be added to meals or drinks, and they also have turmeric products on the shelves. Next, we have a more popular one, vitamin D. Vitamin D deficiency actually affects 2 out of 3 of women of childbearing age, and 20 to 80% of women have a vitamin D deficiency. So vitamin D deficiency is actually linked to increased depressive symptoms, and a study shows that vitamin D supplements or obtaining vitamin D can lower depressive symptoms and fatigue. So where can we get vitamin D? Of course, we have sun exposure, which some people are more fortunate to get more of that than others depending on where you live. But there are also food sources where you can get vitamin D, such as fish liver oil, beef liver, mushrooms, and egg yolk. And then there are also vitamin D supplements, but if you are to take any supplements, make sure you can consult your doctor first. Next we have omega-3 fatty acids. So omega-3 fatty acids are also an anti-inflammatory. Studies show that they can balance chemical reactions in the brain, and they're also shown to have beneficial effects on depressive symptoms. So what are some sources of omega-3 fatty acids? So first we have fish and other seafood such as salmon and tuna. Those are some great options to obtain those omega-3s. Next we have nuts and seeds. So those can be maybe walnuts, flax seeds, and chia seeds. We have plant oils such as soybean oil, canola oil, and flaxseed oil. There are fortified foods such as eggs, yogurt, juices, and milk. And then we can also use supplements as an alternative, but of course, like I said, to use supplements, make sure you're consulting your doctor. Next, in this segment, I will be discussing stigma surrounding mental health. So what is stigma exactly? So stigma can be defined as the negative social attitude attached to a characteristic of an individual that may be regarded as a mental, physical, or social deficiency. A stigma implies social disapproval and can lead unfairly to discrimination against and exclusion of the individual. So why is stigma surrounding mental health important to discuss? So postpartum mental health disorders are still socially stigmatized despite how common it is. The term postpartum depression is known, but those who are affected tend not to speak up about it until after the fact. Stigma surrounding postpartum is unique in many ways. It is unique because mothers tend to feel fear towards speaking up about their symptoms to professionals. They fear things such as CYS being called, and this may make a mother feel incompetent to care for the child. Stigma can cause mothers to feel ashamed for feeling anything but happy during this time in their life. You always hear about a child being the best thing that's ever happened to you, and while that might be true, there can be mental challenges that moms may not expect. Having a child takes major toll on a mother's body, and many can find it hard to juggle all of the roles that motherhood takes on while also being able to take care of themselves. So here are some types of possible stigma, and this is not an all-inclusive list. So there can be internalized or self-stigma, or some may call it personal shame, treatment stigma, stigma surrounding seeking mental health treatment, perceived stigma, and experienced stigma. Internalized or self-stigma can also be known as personal shame, and this can be defined as a person's negative feelings about their own symptoms. This may look like shame or embarrassment about how they're feeling. And this type of stigma can impact a parent's confidence or self-efficacy. Mothers may have significantly higher internalized stigma than fathers. Higher internalized stigma at 1 month postpartum, the lower self-efficacy that parent had at 4 months postpartum. And this may be due to the belief that motherhood is tied to the female identity. So next we have treatment stigma. So stigma surrounding treatment can be the perceptions or negative thoughts about the type of treatment people are receiving for their mental health. Different types of treatment can include prescriptions, mental health counseling, herbal remedies, and spiritual counseling. So what about stigma surrounding seeking mental health treatment? So 65% of those with mental illness do not seek help at all. Help seeking can be inhibited if the community is perceived as holding that negative stigma. Research shows that those who seek professional help are actually stigmatized more than those who do not. And this may be due to people believing that those that receive mental health treatment might have a more severe illness or severity of symptoms than others. And also many avoid getting treatment due to the label of having a mental illness. So many might be experiencing postpartum depression, but they are avoiding seeking the help because they don't want that official diagnosis. So next we have perceived stigma, and this can be defined as a person's perception of being stigmatized by others because of their symptoms. Postpartum mental illness can be left untreated due to this because of mothers' fears of being judged. Mothers may feel as if they're being branded as a bad mom if they seek help for their mental illness. So next we have experienced stigma, which is experiencing stigma directly. So this could be someone saying something negative directly to you regarding your mental illness. Experienced stigma can actually lead to lower social support as well. This can be due to being less likely to engage with others due to fear of the experienced stigma. Can also be experienced through indirect support seeking as well. So an example of indirect support seeking would be talking to a friend hypothetically about your mental illness. Maybe you're saying that you're sick of feeling tired all the time, or you're sick of feeling sad all the time, but you're not actually asking that friend for support or advice directly. So going about it in this direction could lead to negative responses from your support system, which would make you less likely to go back to that person for help or support. So experiencing that indirect support seeking could lead to avoiding help, maybe even withdrawal from treatment or avoidance from treatment altogether. So now that we've discussed stigma and all of the different types, how can we work on reducing it? So first, it's important that what people see is an actual portrayal of therapy. Over the years, TV shows and other media have put a negative portrayal out of therapy. Although this can be out of your hands, it might be helpful to speak up about a negative representation or talk to people that are unfamiliar with therapy and explain what it is really like. Second would be educating yourself and others on mental illness. So be sure to do this through reliable sources such as websites that say maybe .org or .gov, or through evidence-based research articles. Books and videos can be a great educational source as well. I myself like to attend free trainings or seminars on mental health if I see them. Third is contacting peer support. Having contact with others that have a mental illness or are seeking treatment can be beneficial as well because it can bring out great conversation and education as well as relatable info. And the best way this can be done is through support groups. So to end today's module, I put up a little knowledge check. So an individual's negative feelings about their own symptoms is what type of stigma? A, experienced, B, perceived, C, internalized, or D, treatment? The answer here would be internalized stigma, and that's defined as a person's negative feelings about their own symptoms.
Today I'm going to be discussing sensory processing disorder and how it relates to feeding. By the end of this presentation, you will be able to define and understand sensory processing disorder, abbreviated SPD. You'll be able to explain sensory eating. You'll be able to describe messy play and its stages. And you'll be able to list occupational therapy activities for the 5 senses in relation to sensory processing disorder. So what is sensory processing disorder? Sensory processing disorder, again abbreviated SPD, is a condition that affects how your brain processes sensory information or stimuli. Sensory information includes things you see, hear, smell, taste, or touch. SPD can affect all of your senses or just one. SPD usually means you're overly sensitive to stimuli that other people are not. But the disorder can cause the opposite effect too. In these cases, it takes more stimuli to impact you. Those with SPD may also have or show similar symptoms to those who have autism spectrum disorder, hyperactivity, attention deficit disorder, anxiety, and more. Sensory processing disorder can affect one sense or multiple senses. Children who have SPD may overreact to sounds, clothing, and food textures, or they may underreact to sensory input. This causes them to crave more intense, thrill-seeking stimuli. Some examples include jumping off tall things or swinging too high on the playground. Also, children with SPD are not always just one or the other. They can be a mixture of oversensitive and undersensitive. Children may be oversensitive to stimuli and avoid sensory stimuli if they think that clothing feels too itchy or scratchy. They think lights seem too bright. They think sounds seem too loud. They think soft touches feel too hard. They experience food textures that make them gag. They have poor balance or seem clumsy. They are afraid to play on the swings. They react poorly to sudden movements, touches, loud noises, or bright lights. And they have behavioral problems. Sometimes these symptoms are linked to poor motor skills as well. Your child may have trouble holding a pencil or scissors. He or she may have trouble climbing stairs or have low muscle tone. He or she may also have language delays. Children may be undersensitive to stimuli and seek sensory stimuli if they can't sit still, seek thrills such as jumping, they love heights or spinning. They can spin without getting dizzy. They may not pick up on social cues. They may not recognize personal space. They may chew on things such as their hands or clothing. They seek visual stimulation, like electronics. They have problems sleeping, and they may also not recognize when their face is dirty or their nose is running. So what causes sensory processing disorder? Doctors don't actually know what the cause is. They're exploring a genetic link, which means it could run in families. Some doctors believe there could be a link between autism and sensory processing disorder. This could mean that adults who have autism could be more likely to have children with sensory processing disorder. But it is important to note that most people who have sensory processing disorder do not have autism. How is SPD diagnosed? Parents may recognize that their child's behavior is not typical, but most parents may not know why. Don't be afraid to discuss your child's behaviors with their doctor. He or she may refer you to an occupational therapist. OTs can assess your child for SPD. OT will likely watch your child interact in certain situations with certain stimuli. However, there is no formal diagnosis for SPD, as it is not included in the DSM-5 or ICD-10, the most widely used diagnostic sources in healthcare. Treatment for sensory processing disorder is usually done through occupational therapy. Research shows that starting therapy early is key for treating SPD. Therapy can help children learn how to manage their challenges. OT will help you and your child learn how to cope with SPD. Sessions are based on if your child is oversensitive, undersensitive, or a combination of both. Occupational therapy uses sensory integration. This type of treatment uses fun activities in a controlled environment. With the OT, your child experiences stimuli without feeling overwhelmed. He or she can develop coping skills for dealing with that stimuli. Through therapy, these coping skills can become a regular, everyday response to stimuli. Occupational therapy can also create a sensory diet for your child. A sensory diet is not your typical food diet. It's a list of sensory activities for home. These activities are designed to help your child stay focused and organized during the day. Like sensory integration, a sensory diet is customized based on your child's needs. Your child also may need OT to help with other symptoms related to SPD. OT can help with fine motor skills, gross motor skills, everyday activity skills, and more. This video is an overview of what I just discussed regarding sensory processing disorder. They do a great job of explaining it and giving an overall synopsis of what I just discussed. Those who are diagnosed with SPD often have difficulty during mealtime. This is due to the child being a sensory eater. So what is sensory eating and why is it different from picky eating? Picky eaters don't like a variety of foods, much like the sensory eater. However, when picky eaters try new foods, it doesn't cause a sensory overload. What do I mean by eating causing a sensory overload? It can come in a few different forms. There is a sensitivity to textures where children can only handle one texture, such as smooth, pureed foods. In this case, they might be able to eat yogurt, however, hand them a bag of chips or a slice of turkey, and they immediately begin to gag. This is one of the most common sensory eating issues. There are also sensitivities to flavor and smell. A child who has a sensitivity to flavor may break out into a cold sweat and become red-faced and teary-eyed because something was too sugary or too acidic. When it comes to sensory eating, you may be asking yourself, what does this mean when it comes to my child eating? It means that a child might not eat because they don't want to put food in their mouth that might cause physical or mental discomfort. For example, if I offered you a ghost chili pepper right now, how likely are you to just pop it into your mouth without hesitation? Probably not. Unfortunately, as time goes on, some inevitable behaviors begin to develop due to the discomfort eating causes. Your child might begin to fear foods and mealtimes. They may begin to refuse to eat as they begin to regard eating as a negative experience. Eating out in restaurants and enjoying the social aspects of a meal can also be challenging for a child with sensory eating issues. Parents often provide constant reminders and prompts to get a child to complete each meal every day. This often lends an additional level of stress surrounding food, eating, and mealtime. Adding to the list of fears that parents have are things like vitamin deficiencies as well. Suddenly, it's not just the body's psychological reaction to the food, but also the behavioral and emotional stress that can come along with it. Children who develop severe fussy eating behaviors may be affected by growth problems, nutritional deficiencies, dental decay, dehydration, and severe constipation. Here are some tips and tricks to use with sensory eaters. 1. Remember to not pressure your child. There is already enough fear associated with eating that you don't want to increase those fears. As scary as it is to hear a diagnosis of failure to thrive, placing added pressures on them to eat will not help. 2. Address their fears and validate them. Let them know you understand how hard it is for them to eat certain things and that that's okay. 3. Make food fun. Desensitizing them to foods is important. I'll be going over more examples of this on the next slide. 4. When you feel they are ready, introduce new foods in small increments. As your child gets older, his or her sensory system can naturally mature. However, the fear and behaviors they might have developed over in the early years might remain. To combat these fears, you must go slowly. I have examples of activities to introduce new foods and tastes on the next few slides. 5. The trying plate is another method to use for taste. I will go into this in the next few slides as well. It's important to remember to not pressure your child and go slowly. Remember, children with sensory processing disorder and related diagnoses are not just picky eaters. Now I want to discuss treatment methods for children with sensory processing disorder and children with similar sensory difficulties. Messy play is the first treatment method I will discuss. Messy play can appeal to children of all ages and stages of development. It is fun and responds to the changing needs of individual children. The idea of messy play is to get used to how food items and drinks look, smell, feel by using their hands and faces without any focus on eating and drinking. It is a way of engaging the senses through play. In normal development, touch, especially around the mouth, is associated with pleasant sensations, and eating provides positive reinforcement. However, some children become hypersensitive and have limited or non-existent positive experiences with food and eating, which can result in avoidance of certain textures and food types. Messy play promotes tactile input and fine motor skills, while it discourages picky eating. As a guide, messy play has 5 stages of progression prior to eating. Tolerates, so tolerating the sight of food. Interacts with, so interacting with the food container or talking about the food. Smells, touches, and tastes. Messy play activities with food can encourage and support children to climb these steps in a fun, non-threatening, and supportive way. Guidelines for messy play with food include substances used in messy play activities are suited to the child's swallowing abilities, in case they try to eat them, and that the child could be comfortable with each stage before progressing to the next. There are 3 stages of messy play, or food play progression. Stage 1 is pretend food play. This may look like playing shop and tea party using toy food or different textures such as plastic, wood, and other materials. Or imaginative play using favorite toys at a tea party. Stage 2 is using dry food play. You can progress from coarse to increasingly fine dry textures. Dry food play includes cereal, So Rice Krispies, shredded wheat, cornflakes, porridge oats, uncooked pasta, dried beans and peas, hard sweets, lentils, flour, rice cakes, and more. Note that the transition from dry to wet consistencies can be aided by the use of utensils and gloves. So stage 3 is wet food play. Wet food play includes firm wet textures, liquids, and mixed textures. For example, firm wet consistencies include bread dough and marzipan. Wet tacky consistencies include cooked pasta, lentils soaked overnight, or instant mashed potatoes. Wet semi-solid consistencies consist of set custard, jelly, yogurt, and jam. Wet liquid consistencies could look like pouring custards, pouring cream, and melted chocolate. Wet mixed textures include pasta and sauce, rice pudding, pizza with a topping, cream, tomato sauce, custard, chocolate spread, and a mixed yogurt, cooked cold spaghetti, or biscuits. And these are just examples. Moving on from messy play, I'm going to go into different occupational therapy activities for the 5 senses, starting with touch. Desensitizing your child to foods is important. Include them when you're cooking a preferred meal or baking cookies. Let them mix the batter with their hands and get messy. Do art or craft projects that involve messy textures and playing with food. For example, you can make chocolate pudding and crush up Oreo cookies to make dirt, then place gummy worms in the dirt, etc. Make sure you let them get used to the textures on their hands first. You can introduce a sensory bin and let them explore different textures such as uncooked pasta, rice, beans, and more. Or have a bin with dry cereal, raisins, and other materials. With toys that they can play with in the bin, such as adding a dump truck and letting them fill up the cereal and dump it out. In time, they may try a bite of the cereal and like it. Progress may be slow, but with time you'll see improvement. For example, your child might not like anything messy on their hands, including paint, glue, and any food. Over time, and by completing crafts daily, your child may allow paint or glue to get on their finger, then on their hand, and then they may not even notice it there for a while. With baking, they may help you mix batter with a spoon, then stick their finger in the batter to feel it another day, and then mix it with their hands and be okay with that texture. Moving on to activities for taste. You could implement a tasting chart for the days of the week. It could be something like this. Monday, your child will kiss the food or touch it to their lips. On Tuesday, they'll lick the food. On Wednesday, they'll hold a bite of food in their mouth. And on Thursday, they'll chew a bite and swallow. Friday, they get a reward for completing the Monday through Thursday activities with a preferred snack or food. After your child has successfully chewed and swallowed that initial bite, every day following you might suggest that they take one more bite of the new food for about a week. Then the next week take 2 bites, and so on, until you feel that they are eating an acceptable amount to incorporate into meals. Another method is to try a feeding train. Each compartment of the train contains foods they like, and then when they get to the caboose, it contains the new food. The expectation is that their interaction with the food remains the same due to the incremental stages. The trying plate is another method, as I discussed earlier. You can place a new food on the trying plate and allow your child to take bites when they are ready. This plate is separate from their breakfast, lunch, and dinner plate. These tasting methods could be used at 1 meal per day or during snack time. Moving on to activities for smell. The smell of food can be overwhelming or underwhelming for those with sensory processing difficulties. You can add extracts or herbs such as vanilla, lemon, cinnamon, banana, peppermint to dough or water and have your child smell it. You can talk about the odors you smell during an activity like finger painting with foods such as whipped cream, pudding, peanut butter, applesauce, and more. You could also play a game of Guess That Food by placing familiar foods under the nose of the child while their eyes are covered and have them guess what food they smell. Try incorporating a new smell every so often. This makes food fun and those weird smells are not so scary. Next, I have activities for sound. Environmental stimuli can be overwhelming when a child is eating and may cause them to not want to eat at all. Try limiting sounds in their environment during mealtime. Make sure the TV is off, there is no loud music, and that people aren't talking loud or yelling during mealtime. You can play relaxation music or nature sounds in the background for white noise or soothing music during mealtime. There are also activities for sight as they relate to eating. Those with sensory processing disorder can be overwhelmed by visual distractions or need an increase of visual stimuli. You can reduce visual distractions by creating a barrier such as a cardboard corral while they are eating, so they aren't distracted by the environment around them and they can focus on their plate. You don't want to have too much on the plate at once either. This could be overwhelming for them. Offer a few bites of food at a time and limit the variety of foods on their plate as this could again be overwhelming. Offer solid colored plates and utensils. Plates or utensils with characters on them again may be too overwhelming for them and limit their focus on eating. You can increase visual attentiveness by offering foods on a plate that have a high contrast to each other, such as giving your child a white plate so they can see the orange slice or trick cereal easily. Make sure their eating environment is well lit. If they don't know what the food is because they can't see it properly, they may be less likely to eat it. So I have a knowledge check question for you. It's a select all that apply. Which of the following are true of messy play and messy eating? A, it promotes tactile input. B, it promotes fine motor skills. C, it discourages picky eating. Or D, it delays healthy eating. So which of the following are true of messy play and messy eating? The answers are A, B, and C. That messy play and messy eating promote tactile input, they promote fine motor skills, and they discourage picky eating. A few resources I found that I thought were beneficial include sensory bin ideas to try with your kiddos and more sensory strategies to try for all the senses. These links will be below.